ask about. What is really going on with your body after you give birth? We're going to break it all down from that initial bleeding to when you can expect your first period to make a comeback.
So let's just dive right into the big questions. What's normal? When will things feel like they're back on track? It can all feel a little overwhelming and confusing, right? But stick with me, and by the end of this, you're going to have a much clearer picture of what your body is up to.
First things first, let's talk about the bleeding that starts pretty much the moment your baby arrives. Now, pretty much every new mother goes through this, but it's so often confused with a period when it's actually something completely different.
Yeah, see, this initial bleeding isn't a period at all. It's a special process called postpartum bleeding, or if you want to get technical, it's called lochia. Just think of it as your body's amazing built-in cleanup crew, getting everything tidy after 9 long months of hard work.
And this is where you can really see the difference. When you put them side by side, it's super clear. Lochia is a one-time cleanup that can last for weeks. A period, on the other hand, is just part of your regular monthly cycle. They have totally different jobs, different timelines, and they're even made of different stuff.
So what's this going to be like? Well, at first, it can be really heavy, and you might see some pretty large blood clots, which can be a little alarming, but it's usually a totally normal part of your body healing. The most important thing to watch for is that the flow should gradually, slowly, get lighter over time.
Okay, so once that initial postpartum bleeding finally wraps up, the next huge question on everyone's mind is, when is my actual period going to show up? And, there's no single magic answer here because it's completely different for everyone.
But that timeline isn't just random. While things like your overall health definitely play a role, this single biggest factor, the one that influences this more than anything else, is how you choose to feed your baby. And the science behind this is actually so cool. When you breastfeed, your body produces this hormone called prolactin. Its main job, of course, is to make milk, but it has this powerful side effect. It basically hits the pause button on ovulation. And hey, no ovulation means no period. It's as simple as that.
This chart just breaks it down perfectly. If you're using formula or doing a combination of formula and breast milk, your period might be back within just a couple of months. But if you're breastfeeding exclusively, it is completely normal for that return to be delayed for much longer, sometimes even for a whole year. And feeding isn't the only piece of the puzzle. Your delivery experience matters too. If you had significant blood loss, for example, your body just needs more time. It has to focus on recovering its resources and building back its strength before it can even think about restarting your cycle.
So after weeks, or maybe even months, the day finally comes. Your period arrives. But what can you expect? Let's get you ready, because it might not be exactly like the one you remember.
I think this is the most important thing to keep in mind. Your body has been through a monumental, life-changing event. So it just makes sense that the period you get back might not be the same old period from before. You're basically establishing a whole new normal.
And here are some of those common changes you might see. The flow could be heavier. You might notice more clots as your body finishes that final clean-out, and the color could even be a bit darker than usual. Oh, and it's also super common for your first few cycles to be irregular. This is all just part of your body finding its new rhythm.
All right, let's pause here, because this is probably the most important part of this whole conversation. We need to know the difference between what's normal healing and what's a sign that you should probably check in with your doctor.
Okay, so during that initial postpartum bleeding phase, those first 6 weeks or so, keep an eye out for these signs. Soaking through a pad in just 1 hour is too much. If the bleeding just stays heavy and doesn't seem to get lighter over time, or if it stays really heavy for over a month, it's time to make a call. That could signal an issue that needs attention. And then, when your first actual period comes back, the red flags are a little different. If that heavy bleeding goes on for more than a week or 8 days, or if you're experiencing pain that's so intense you need painkillers to manage it, please consult your doctor. They can make sure everything is okay internally.
So let's kind of wrap this all up. Your body is on this remarkable, unique recovery journey. And while most of the changes we've talked about are completely normal, true empowerment comes from knowing what to expect and knowing when it's time to ask for help.
And we'll just leave you with this final thought. After pregnancy, your body has a brand new story to tell. Being patient with it, being observant, and really being in tune with its signals is the absolute best way to support your own health and healing.